digestive system, you know, what are the digestive system start from your 12th standard knowledge. Where start from? Digestive system from mouth, because mouth are not properly a digestive system, because you can breathe with mouth, so it can help during your respiration also. So structurally it is start from your pharynx, then the esophagus, then the stomach, and the small intestine and large intestine. These are the structures. Okay, so this is the structure of your digestive system. And digestive system, it help, what are the it is basically consist of, apart from your two structure, that is the from esophagus and the last part of the rectum and the anus, all are involved in a your either digestion or the absorptions. তাই না? ইসোফেগাসে কিছু ভূমিকা নেই, ইসোফেগাস জাস্ট তোর খাবারটা, মুখের খাবারটা পাস করে দেয় ইন দা স্টমাক, আর রেকটাম তো স্টুলটাকে পাস করে দেয়। বাকি পার্ট গোটাটাই আছে, বিকজ দে আর সামহাউ রিলেটেড টু your digestion and absorption. Okay, now you know the digestive system will also consist of the varieties of tissue. Just like, you know, if you take a boiled potato, you know, so if we chewing it, the potatoes, then the enzyme that is secreted from mouth is the salivary amylase. Food entered into the after stomach in the intestine, the biles are comes out from the livers, and they are mixing with in the food. So there is a role in the livers. Okay, and you know there is a enzyme in the pancreas, that is called pancreatic lipase and pancreatic amylase. So besides this, that is the your digestive system, as I told earlier, from the pharynx to the rectum, there is a role of the gland, like our salivary gland, liver, pancreas is also important. And you know, there is a, I told you that there is a three part, that is called the secretion, digestion and absorption. So secretion from this part, as I told earlier, and the digestions are occur in the stomach and small intestine, and the absorption occurs in the mainly which part of the our gut? Absorptions, anyone? Where the most part of the absorption occurs in our gut? Ileum. This is the, because the, you know, the absorption there's occurs from the from, they need a larger surface, and you know the ileum have a large blood supply. As it is the large blood supply, so they are mainly the absorption part start from the ileum. Okay, and you know there is a in gut there is some protective action also. As you know, the we are taking food, the street food is full mix of bacteria. Street food, ট্রেনে যাচ্ছিস, হট করে বড় ভাজা এলো, খেয়ে নিলি, হ্যাঁ, ট্রেনে কোথায় ওরা ওই পেঁয়াজগুলো কাটা রেখেছিস প্ল্যাটফর্মে যেখানে ইয়ে থাকে তার পাশে কাটে। সো ফুল মিক্স অফ ব্যাকটেরিয়া। সো কি হচ্ছে, when we take this ঝালমুড়ি, this enter into our stomach, and in stomach there is a acid secretion. So these acids that kill the bacteria or the virus that we are taking. Sometime, but sometime it not. That's why the diarrhea occurs. No. So, and there is some cell like M cell in the intestines, which have a role in the your protections. Okay, and you know that digestive system, it is also the there is a movement. It is called the peristaltic movement. তাই না? তোরা যখন ওয়ার্ডে যাবি তখন গিয়ে কি দেখবি যে পেশেন্ট বমি করছে, there is a huge abdominal swelling, and if you just stethoscope and you place it in the abdomen, there is a no peristaltic sound. Peristaltic sound like grinding sound, grinding যেমন হয় সেরকম sound. So that is called the peristalsis. So actually you know, the if you want to have good physicians, not surgeons. There is a surgeon, that is the different skill. Only few are the have entered into that domain. All 70 or 80% doctors are going to a physician somehow. General physicians, specialist physicians, cardiologists, neurologists, all that. You enter any stream beside a good surgeon. There is a two subject. One is the physiology and second is the pharmacology. Will guide you everywhere. So in all subjects are important. That is no doubt. But to become a good physician, two subjects are mostly important. That is the physiology and the pharmacology. Because physiology guides you what is the normal and what is the abnormal, and pharmacology guides you if there is a abnormal, what the medicine that you should give to this patient, and what the medicine in that situation we should not prescribe these patients. So that is two things are most important. So if you want to be a good physicians, physiology and pharmacology, this is the two subjects that always guides you to a different from the other people. Because in the DM, the extreme subject, that also teaches you the physiology and the pharmacology. DM endocrines or the DM neurology or DM cardiology, all are dealing with the physiology and pharmacology of that subjects. Okay. So if you don't know the what is the peristalsis, and so in the word you cannot differentiate that it is the normal persons, normal peristalsis, or it is a loss of peristalsis, that is called the intestinal obstruction. You know, if you don't know the what is the peristalsis. Okay, so and you know the intestine peristalsis কি করে? Peristalsis তো গ্রিন্ডিং এর কাজ করে। গ্রিন্ডিং মানে কি হচ্ছে দেখুন, ইন দা মায়েরা যেমন কি করে মিক্সার গ্রাইন্ডারে যেমন যেমন করে, পেরিস্টলসিস সেটাই করে। পেরিস্টলসিস জাস্ট অ্যাক্ট অ্যাজ এ গ্রিন্ডিং, মানে তোর খাবারটা খেলি and the enzyme are coming out, and they just by mixing, and that the role of peristalsis. Just it is the mixing of the digestive juice and the food that you are taking. Okay, so that is the role of peristalsis, and it is the forward movement. You know that from you taking it from enter into the esophagus, then the movement enter into the stomach, then the movement, small intestine and large intestine. So that is the movement are going on. Okay. Second thing, the the general anatomy of the GI system. তোরা যখন অ্যানাটমি পড়বি তখন অ্যানাটমি তোদের হিস্টোলজি পড়ানো হবে, সেখানে সবই পড়ানো হবে, জাস্ট আ ওভারভিউ, ঠিক আছে? সো যদি তুই একটা ইন্টেস্টিন কে ক্রস সেকশন অফ আ ইন্টেস্টিন, so that is a 4 layer, that is the mucus layer, submucous layers, muscles layers, okay, and the serosal layers. All are written in your books, so please listen. And what the topics that are important for your exam, I will tell you, and that's things you are just in your room, just read one times, and that is enough. Okay, these topics are not important for your exam. Which topic is important, I will tell you. Okay, so there is a what is the mucous membrane? Now mucous membrane, the mucus layer, upper layers. So in your intestine, the mucus layer is always a three layers. First is the columnar layers. Okay, all your GI tract, if someone asks you the which of the cell, then you always tell is the columnar epithelium, because it is universal in all layers. Okay, and the second layer, that is the reticular layer, that is called the lamina propria. And the third layer, that is the layer of a thin muscular layer that differentiate it from the mucus layer from the submucous layers. So there is a 3 layers. Okay, তাহলে প্রথমটা কি হলো তোর columnar epithelium, নেক্সট লেয়ারটা কি হলো, নেক্সট লেয়ার হচ্ছে যে লেয়ার, সেই লেয়ারটা হচ্ছে তোর that is the consist with the reticular layer, what is also called the lamina propria. And the third layer, that is the below it, that is a layer that differentiated from the mucosa from submucosa. It is a thin muscular layer. হয়ে গেল, গল্প শেষ। Then the submucosa. Submucosa কি হচ্ছে? Submucosa, it is consist of the alveolar cell layers. এটার থেকে ইম্পর্টেন্ট হচ্ছে সেকেন্ডটা, যেটা হচ্ছে all the blood vessels, all the nerve, all the lymphatics, whatever it is present in our GI tract, that present on that layer, that is the submucosal layer. Okay, next the muscles layer. There is a 2 type of muscles layer, এটা হচ্ছে outer longitudinal muscle layer আর ইনার হচ্ছে সার্কুলার মাসল লেয়ার্স। তাহলে প্রথম হলো মাসলস মিউকাস লেয়ার্স এন্ড দেন দ্য সাবমিউকাস লেয়ার্স। ওকে, তাহলে সাবমিউকাস লেয়ারের ইম্পর্টেন্স কি আছে না, সাবমিউকাস লেয়ারের ইম্পর্টেন্স এটাই আছে যে all the vessels, blood vessels, lymph node and the nerve plexus, all are situated in the submucous layers. Okay, then the muscles layers of 2 types. একটা হচ্ছে one the outer longitudinals and inner circulars. Okay, that is the 2 types. And that in circular muscles, like the circular muscles are formed the sphincter যেগুলো আছে না, যেমন হচ্ছে আমরা ধর if we taking any foods and the foods enter into the esophagus, and after esophagus they enter into the stomach. After that the esophageal sphincter, that made up of circular layer, that is closed, and that is the no foods are coming out from the your stomach. এখন what is the importance of this? When you are in OPD, out of 10, that is 5 patients are coming out with the burning sensation in the esophagus. ডাক্তারবাবু গলা বুক জ্বলে যাচ্ছে. What is this? This is called the GERD, gastroesophageal reflux diseases. And this how then what is the etiology of this? Etiology of this that the somehow of these persons the tone of the esophageal sphincter is reduced, so that the acid mixed foods that in the stomach, they somehow enter into the esophagus, and that produce the burning sensation in that persons. Out of 10, 5 persons are coming out with these symptoms in your OPD. So that is physiology is everywhere in your clinic. And what is the Graves conditions? Because if you does not you differentiate it a GERD or others, after 5 or 6 years, these patients comes out a in situ malignancy, that is called the Barrett esophagus. Because in esophagus there is a columnar epithelium, and this epithelium is protected by the sphincter. If the acids are coming out from the stomach and it digests the esophagus, lower part of the esophagus, there is a called the dysplastic and later in the metaplastic chains, that is called the esophageal CA. So sphincter is important, but there is a question, the acid digest the esophagus, why not the stomach, So when we discuss about the stomach, then we can discussing why stomach are not digested by the acids. Okay. Now the in the stomach the oblique layer of the muscle are present deep to the circular muscles layers. Okay, and large intestines, this muscles layer, longitudinal muscles layer, there is a form of just irregular structure, and these layers form irregular structures, and these irregular structures called tinea coli. Okay, in that longitudinal muscles layer in the large intestines. Okay. Now the serosal layer, nothing but a peritoneal layers. They are situated in everywhere except 2 parts. One is the esophagus and second is the distal part of the rectum. Besides that, there is every part there is a peritoneal covering. Okay. So that is the importance. Now the innervations of the intestinal tracts, that is a 2 plexus. Okay, and these topics are often come out a short note in your exam. The nervous systems or the innervation of the GI tract, এটা কিন্তু পরীক্ষায় শর্ট নোট আছে, ঠিক আছে? So there is a 100 millions of neuron in our GI tract. It is called the enteric plexus. It is equivalent to a nerve situated in our spinal cord. মানে গোটা স্পাইনাল কর্ডে যত নার্ভ আছে ইকুইভ্যালেন্ট টু নার্ভ আমাদের ইন্টেস্টিনে আছে, and that's why there is a two system, sympathetic, parasympathetic, and what is the third system? First system is the enteric plexus. মনে থাকবে? So that is a two situations. Okay, মানে two differentiate, that is called the mesenteric plexus or auric plexus. Two same জিনিস. Okay. So this plexus, and second is the mesenteric plexus. So there is a two plexus of nerve. So what happened? Now this plexus, the situated mainly in between the, that is called the auric plexus, that is situated in the two muscles, that is the longitudinal and the circular muscle layer. এই দুটোর মাঝখানে থাকে। ওকে, and the কি করে না তোর mainly this regulated the local function of the intestines, যেমন peristalsis এগুলো সব করে। ওকে, and তোর মানে মেনলি হচ্ছে তোর মোটর ফাংশনস, পেরিস্টালসিস করছে। and the mesenteric plexus, these plexus are situated in the submucous layers. বললাম না যে submucous layere কি থাকে, আমাদের নার্ভ থাকে, ব্লাড ভেসেল থাকে। So this is situated in the submucous layers. Okay, and what are the actions? These actions are on the glands. Glande তোর অ্যাকশন আছে, ঠিক আছে, blood vessels and the regulation of intestinal secretions. তাহলে একটা প্লেক্সাস কি করছে, তোর পেরিস্টালসিস মুভমেন্ট বা মোটর মুভমেন্টকে কন্ট্রোল করছে, আর একটা প্লেক্সাস কি করছে না, সেকেন্ড প্লেক্সাস তোর গ্ল্যান্ড সিক্রেশনস দ্যাট পার্টটাকে টেক কেয়ার করছে, ঠিক আছে। And there is a lot, there is the neurotransmitters like GABA, like ATP. GABA মানে হচ্ছে গামা অ্যামানো বিউটারিক অ্যাসিডস, GABA nitric oxides, ATP adenosine triphosphates. Okay, and the carbon monoxides, all are the mediators. By this take the nitrous oxides কি করে, nitrous oxides in everywhere it acts as a vasodilators. তাহলে কি হবে, যখন তুই after taking foods, there is for the digestive purpose of the absorption purpose, when there is a require a large amount of blood supply, then cause the vasodilatation. If there is a vasodilatation occur, what happen? There is a large amount of blood supplies. So there is a actions. Okay, so ATP provides the energy. So that is the actions. Okay, and besides this enteric plexus, there is a two nerve control in our GI system, and one is the sympathetic and the parasympathetic. Okay, so what is the action of sympathetic? So sympathetic means the nerve of today, এখনই লাগছে। আর what is the parasympathetic means হচ্ছে nerve of tomorrow, মানে পরে হলেও হবে, তাই না? সো মানে sympathetic মানে কি হচ্ছে, দ্যাট ইজ দ্য অস্থির, আর প্যারাসিম্প্যাথেটিক মানে হচ্ছে মানে কাম আর কি। ওকে, সো প্যারাসিম্প্যাথেটিকের কাজ কি হচ্ছে? প্যারাসিম্প্যাথেটিকের কাজ হচ্ছে তোর ইনক্রিজ দ্য মোটিলিটি, ইন্টেস্টিনের কি করছে, মোটিলিটি করছে। মোটিলিটি করতে গেলে কি করতে হবে, খাবারটাকে ফুডটাকে পাস করাতে হবে। তাহলে ফুডটাকে পাস করাতে গেলে কি করতে হবে, স্ফিংক্টারগুলো কি 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 করতে হবে, ডাইরেক্ট করতে হবে। তাহলে কি করতে হবে, তাহলে একটা হলো মোটিলিটি বাড়াতে গেলে স্ফিংক্টারকে ডাইরেকশন করতে হবে। তাহলে মোটিলিটি বাড়াচ্ছে, স্ফিংক্টারকে ডাইরেকশন করছে, আর কি করছে, তোর সাম হেল্প ইন দ্য সিক্রেশন ফ্রম দ্য গ্ল্যান্ড, গ্ল্যান্ড থেকে সিক্রেশনটাকে বাড়াচ্ছে। তাহলে প্যারাসিম্প্যাথিকটা কাজ করবে, ইউ নো দ্য সিম্প্যাথেটিক উইথ দ্য অপোজিটস। তাহলে ও কি করছে, তাহলে দেয়ার ইজ এ ডিক্রিজ অ্যামাউন্ট অফ কন্ট্রাকশন ইন আওয়ার জিআই সিস্টেম। তাহলে যদি ডিক্রিজ অ্যামাউন্ট অফ কন্ট্রাকশন করতে হয়, তাহলে স্ফিংক্টারগুলোকে কি করতে হবে, কন্ট্রাকশন বাড়াতে হবে, তবে না মুভমেন্টটা সিজ হবে। তাহলে কি করছে, ডিক্রিজ অ্যামাউন্ট, ইনহিবিট দ্য কন্ট্রাকশন অফ ইন্টেস্টিন বাই দ্য কন্ট্রাকশন অফ দ্য স্ফিংক্টার, স্ফিংক্টারগুলোকে কন্ট্রাকশন করে দিচ্ছে। ওকে, and the characteristic response of sympathetic and parasympathetic stimulation on the activity of gastrointestinal tract are considered appropriate because the sympathetic nerves are stimulated in the situation in the emergency. বললাম যে মানে তোর সিম্প্যাথেটিক হচ্ছে যখন স্টিমুলেট হবে তখন হচ্ছে মানে দেয়ার দ্য মানে সে ওই ডাইজেশন বাদ দিয়ে বাকি সব কাজগুলো করবে, বুঝতে পারলাম। মানে সিম্প্যাথেটিক স্টিমুলেশন হোয়েন স্টিমুলেট দ্যাট, মানে আমাদের ইন্টেস্টাইনের কাজ কি, ডাইজেশন করা। তা সিম্প্যাথেটিক কি এমার্জেন্সি এই জন্যই বলা হচ্ছে, হোয়াট ইজ কল এমার্জেন্সি, বিকজ দ্য হোয়েন সিম্প্যাথেটিক স্টিমুলেশন they are doing everything except the digestion, digestion বাদ দিয়ে বাকি সবই করবে। ওকে, and প্যারাসিম্প্যাথেটিক এই যে ধর এখন তোরা খাওয়া দাওয়া করে ক্লাস করতে এলি, আবার কখন খাবি হচ্ছে একটা সময়, তো এই যে মাঝখানের মিন টাইমে যে আমাদের ইন্টেস্টিনের যে অ্যাক্টিভিটি, all are controlled by the parasympathetic nerve। একটা বিজাল একটা তোর কনসিস্টেন্সি মেনটেন করছে থ্রু আউট দ্য ডে, বুঝতে পারলাম। তাহলে সিম্প্যাথেটিক হচ্ছে তোর যখন অ্যাক্টিভেট হবে, it will do everything except the digestion. Besides that, there is a we are taking foods in the morning and in the afternoon, after that in the evening and after in the night, and there is a fasting state of night up to 8 am, from 9 p.m. to 8 am, that is the fasting periods, and these periods the function of your intestine are maintained by the parasympathetic nerve. Okay, just to a continuous process. Okay, and there is a two reflexes are there, actually long reflexes and short reflexes. What is the long reflex and what is the short reflex? Long মানে হচ্ছে জানিস, long মানে অনেক লম্বা, তার মানে and when you there is a reflex ওদের আলাদা করে পড়ানো হবে, there is a 3 component is there. One is the apparent, it is a 12 knowledge, apparent nerve, then the spinal cord and the efferent component, na? So in long reflexes, The afferent are situated in the intestines, and the centers that are situated in the somehow in your either spinal cord or the brain. Okay, so that is a stimulation in the intestine. They reaches in the spinal cord, from the spinal cord to the brain, and the efferent coming from the brain, and the enter into the afferent, and the afferent and the efferent is situated, receptors is situated in the intestine. So there is a lot more path to be covered. So that's why it is called the long reflex. Okay. And what is the short reflex? The afferent are situated in the intestines. The center are situated in the intestines, and the efferent are situated also in the intestine. So there is a local response. So there is a very short path to be covered. So that's why that name is the short reflex. So there is a two reflex. What is the short reflex, and second is the long reflex. Last part is the blood supply. ঠিক আছে, blood supply তো অ্যানাটমিতে খুবই ইম্পর্টেন্ট। ঠিক আছে, so blood supply in the intestine, that is made up of celiac artery, superior mesenteric artery, and the inferior mesenteric artery. These are the arteries where your blood supply of the intestine is maintained. And in your MCQs, now you are super smart, and you're taking MCQ for your postgraduate preparations. In anatomy, each year there is a questions comes out from these topics, the blood supply of the intestines. You check the anatomy part of the MCQs, there is definitely one questions coming out from the supplies, because there is a watershed lines. The watershed lines above, there is supply by the superior mesenteric artery, and watershed line below, it is supplied by the inferior mesenteric artery. So there is a watershed lines is there. So this is the very important topics for your post graduations. And you know the blood supply in the intestines, there is a huge amount of anastomosis is there. Anastomosis মানে হচ্ছে তোর there is a junction between the artery and vein. Actually, that is the capillary and the venules. There is a huge amount of anastomosis is there, and you wonder why this there is a huge amount of anastomosis in our intestines, because if we taking a heavy meals, there is need for digestions, absorptions. So that for that purpose, there is a huge amount of blood supply needed. To provide the huge amount of blood supply to the intestines, these collateral circulations are then opened to provide intestine a huge amount of blood supply for the digestions and absorptions. So, and you think if you are fasting and now you are taking a heavy meal, the blood supply is 100 times from the fastings. Okay, So 100 times more blood supply is needed. So that's why the intestine is, the anastomosis is also this importance. Okay. So this is the structure and the functions of you know uh, your intestines. Okay, and in the GI systems, that is obviously that is not as interesting as uh, your CVS or the respiratory system or the endocrine systems, because these those topics are really correlated, but there is a you compare when you're sitting in your OPD, and when you compare the patients, there is a, if 10 patients are coming to your OPD, 6 patients are related to our GI systems. Though it is the less interesting subject, but that is important in your OPD. Besides that, there is questions, and now whatever you know the uh, patterns of your first professional MBBS questions are changing. Okay, during our times, that is the questions are coming out. That is the mainly the your theoretical knowledge. But recent the guidelines are changes, and what the NMC are trying to establish is that the questions are mainly in the clinics oriented questions. Okay, so there is a lot more questions related to our clinics. So, if you don't know the, we are covering all those aspects of the clinical orientations in your physiology. But to understand the clinics, uh, it is very important to know all about the basic things about the of your GI systems. Okay, so if you don't know the what is the importance of the certain one things like the mucous membrane that I told you is the columnar epithelium made of. But if there is a question of coming out, that is the Barrett esophagus, where the columnar epithelium change into a squamous shell epithelium. So you have to understand that the columnar epithelium is made of GI tract in everywhere. Okay, and besides that, uh, there is a questions of your peristalsis, that is also important, because there is what the if what happened if the anti-peristalsis occurs. There is a situation, one situation where the anti-peristalsis occurs. You know any vomiting, right? In vomiting, there is a anti-peristalsis movement. So you don't know what is the peristalsis and what is the anti-peristalsis. So vomiting, and this is a short note that is coming out in vomiting and vomiting related the medications, the pharmacology is very important. Okay, so today just general digestive systems, their structures, their functions, and next day we are discussing about the GI secretions. GI secretions means what are the GI hormones that is are secreted, what the enzyme are secreted, what are their functions. So just uh, one things I discuss about the in saliva, that is the salivary amylase. No, in the stomach, what is the enzyme? Huh? Key stomach. Huh? No, pepsins. Huh? What are the enzyme that is secreted in our stomach? And you know the this stomach. What is the food are digested in the stomach? Only proteins, nothing else. Because no carbohydrate, no fats, only the proteins part. And uh, the pH of the stomach, only it is below 4 and 4.5, in that range. So your stomach is very important things. And you know the uh, food we are taking, just like the carbohydrate. Carbohydrate, there is a two type of carbohydrates, that is the boiled and unboiled. So and you know the uh, and the lipid part, where it digests, lipid part, duodenum and some part of the jejunum also. Because why? Because to digest the fat, it requires the bile salts, and bile salt from it is enter into that part to mix it along with our pancreatic enzymes. No? So and uh, why these so complicated things occurs? Because all we are taking either carbohydrate or proteins or fat, they are in the complex form. No? So to to break down it as simple form, it is important, so that the absorption are taking place. Now, uh, if you are diabetologist, somehow, so diabetologist, there is some medicine in your in sugar control. This the mechanism of this medicine is to prevent the breakdown of complex carbohydrate to a simple carbohydrate. Because if the simple carbohydrates are theirs, they will be absorbed. So some medicine are coming out that prevent the breakdown of complex carbohydrate to a simple one. So uh, these medicines are helpful in the management of type 2 diabetics. And the digestions and the absorptions, they are happening in the side by sides, because foods are we are taking their absorption and the digestion part are going on side by sides. Okay. Sometimes the digestions and the absorptions are not happens. Just like patients comes in your OPD that the weight loss, the patient coming out weight loss, and the patient are uh, alcoholic or the ex-alcoholic. Then the test we are prescribed is the fecal fat estimations. Okay, fecal fat estimation কি হচ্ছে যে যারা তোর প্যানক্রিয়াটাইটিস বা অ্যালকোহলিক তাদের কি হচ্ছে প্যানক্রিয়াস there is a dearranged in the pancreas and there is a enzyme called pancreatic lipase. There, if there is a problem in the pancreas, so obviously there is a problem in your enzyme also, that is called pancreatic lipase. And if there is a problem in your pancreatic lipase, so what happen? The fat are not properly digested because fat are only related to your pancreatic lipase. So what happened? Then the undigested fats are coming out through our stool, and that's part we are just checking the your fat in your stool. Same things is the your protein. If the patients coming out weight loss, and you know there is a test called the bile acid estimation in the stool. If the bile acids are excess and that is the positive for the stool, so somehow there is a problem in the protein and fat digestions. So if you don't know what is the role and the action of those bile acids or the pancreatic lipase, so it is not possible for you to evaluate a patients having a steadily unwanted weight loss. So it is very important. Again, I repeat my words that if you want to be a good physician, please go through physiology and pharmacology, because two things subjects are very important. Okay, so thank you for your presence. Next class we are discussing about the GI secretions. Okay.